Okay, here we go.
Dr. Anand Swaminathan is on the front lines in the fight against COVID-19. At his New Jersey hospital, dozens of people have lost their lives.
I've never seen anything like this. I've never seen so many patients with critical illness at the same time. I've never seen so many patients intubated and on ventilators.
He spoke to the ABC from the safety of this small room at his emergency department.
Probably about 10 by 8 feet or so.
One of the few places doctors and nurses can take off their protective gear.
We do have patients who die, and we're used to that. We're not used to seeing this volume of patients dying in such a short period of time.
New Jersey has the second highest number of cases and deaths in the nation. It's right next to the epicenter of New York.
First of all, I want to thank all of you for leaving your family and your homes.
Hundreds of paramedics from right across the country have flown in to help.
We're from Ohio. We're just here to help. Because if this happened in my community, I want you to come to see us.
In New York, another 777 people died yesterday. Morgues are at capacity, funeral homes overrun.
You cannot be focused with 30 funerals going on at the same time. My heart breaks, but I wish I could help them, but I can't. I have other families that came first.
Unclaimed bodies are now being buried in mass graves on Hart Island. But some good news, the number of hospital admissions and those in need of intensive care is dropping.
There are fewer people in the intensive care unit statewide than there were. And again, that's the first time we've seen a negative number, so that's good.
On the other side of the country, there are signs California is also making progress. But Australian Dr. Mel Herbert warns against complacency. He retired from his Los Angeles emergency department 4 years ago. He's one of tens of thousands signed up to go back.
It's all hands on deck. This is a once in a lifetime, we hope, pandemic. Hope to never see anything as bad as this again. This is as bad as it was in the pandemic 100 years ago. So in times like this, everybody has to go to war, and this is a war.
As stay-at-home orders continue to cripple the economy, the US president is getting impatient, setting a new target to get things going again by May.
Can you say, sir, what metrics you will use to make that decision?
The metrics right here. That's my metrics. That's all I can do.
That sparked fear among health officials, who warned lifting restrictions would wind back the progress made. The president says he will listen to his top advisors, but ultimately the decision rests with him. Kathryn Diss, ABC News, Washington.